The district is very pro-coverage, and I'm really proud to work in a jurisdiction that has that orientation. The benefit is, if you're interested in health, oral health is a key component of a person's overall health. It's not sort of a little add-on, or it's not cosmetic. It's a very fundamental part of their health. And so beyond the teeth and the related structures, you're looking at helping to improve other health outcomes, pregnancy outcomes, even cardiovascular outcomes, nutrition. So understanding how the oral health benefit fits into that larger context, which I think we do, you're really treating the person comprehensively and addressing the full array of their needs. It even goes so far as issues of self-esteem, which are not light issues, and employability. People with better oral health are more able to obtain employment and maintain that employment than folks who are not. So that's a very important benefit. And then also, we also think it's very important that we're able to enhance access. So by providing a high quality benefit, we hope that will encourage providers to participate and improve access to care for the low-income and vulnerable populations that we serve. Our enrolled providers who open their doors to Medicaid beneficiaries are really able to provide a critical service to folks who really need the service. They improve the health of some of the most vulnerable residents of our city.
Getting patients into the office sometimes is a challenge. They may pull up and not feel good. The day may not be right. So sometimes I've had to go out into the patient's vehicle and do an examination where the patient feels most comfortable around familiar settings. And even if they just come by and say hello, I'm fine with that. A lot of times the patients will need help getting in the door, whether they are ambulatory, semi-ambulatory, and or just don't want to. We've had a patient where he was disgruntled with the driver, and we actually were able to go out and coax him in to the office and fully treat him, as letting him know that he was pretty much in control of the appointment.
We have a patient, she didn't want to even get past the door. She was that terrified, and we took time with her. Every appointment, she got her a little closer all the way to her sitting in the chair. And we actually, every appointment, we worked with her, talked with her about everything, and made her feel as comfortable as possible. It did take a few appointments, quite a few appointments. But we got to a point where she felt comfortable. She actually came in, sat on her own, and we actually got to do dentures on her. Took impressions. Every step, we have a 4-step process here. We did impressions, did the wax try-in, did the wax teeth try-in, and was able to sit the dentures, adjust them. And recently she came in and she can put the dentures in for herself and remove them and show me and she was very happy about, the way she looked, and also about, the functionality of the denture himself. And she came in on her own, left on her own, and she's been coming in and leaving on her own and having the dentures that come out every service.
CEREC, C-E-R-E-C, basically chairside economical restorations.
CEREC is pretty much we mill out the crowns here. Whereas in other offices, you have to prep the tooth, you take the impression, you send it to a lab, and it comes back. And then we seat it. We're pretty much doing all of that here. At chairside with the patient, right then and there, one appointment, you have your crowns.
We've done and manufactured the crown. We basically cement it in place, and with the digital technology, our accuracy of fit has gone up tremendously, so we have very minimal adjustments with it. The digitization of our office has enabled us to provide a higher quality of care to a point where the standard of care is actually going to be in guided placements of implants. We're doing that now currently with our 3D and our CEREC technology, where we're able to, whether it's mill out implant abutments or crowns of any specific nature, whether they're long span bridges, patients that suffer from periodontal disease. And in this patient population, a lot of the patients may not have the dexterity to brush. We had a patient yesterday who was blind and has no feeling in his hands. So his dental care is much different than somebody who can actually brush their teeth and remove or take out partial prostheses or dentures. With the Oral Health Task Force has been very instrumental in helping us put these pieces together in a more global, if you will, way. We have what's called a dental washer, where the instruments are washed, and using a manufacturer's recommendations or OSHA's recommendations regarding the portability of the instruments, we're able to basically ensure that the instruments aren't touched prior to being cleaned. That adds a level of care that providers don't often get to see on a day-to-day basis that we do here. From that, we're experiencing a lot of students, and we're mentoring a lot of students and pre-dental students to feel very comfortable in this type of setting. The technology, once especially the students, we have an open relationship with the College of Dentistry here at Howard University.
But for me, I think that's the biggest thing that I've learned from this experience is look at how important it is to take into account their medical history and their personal history when you're treating them. Not to just think about the dental treatment that you're giving them, but really how the experiences that they've had as an individual affects the way that you treat them.
Being able to be very appreciated by the patients that present to the office, because a lot of them haven't received comprehensive dental care in their lives, and when they're getting or receiving teeth for the first time, it's such a rewarding feature to be able to hug a patient. Or we have to go that extra step, whether it's visiting some of the patients at their home, finding out where they live, finding out what difficulties they have in getting here. Comfort and support of patients that with disabilities is not that much different than you would comfort anyone in a time of distress. Putting music on when they get back to the dental chair. One thing I've found is finding out what that patient needs, and that's basically standing in front of them and talking to them. Some patients with muscle dysfunction aren't able to even look at us, so a lot of times I've had to get on the floor on my knees and look up at certain patients, letting them know that we're there and that they can actually see us. Providers going into this type of a setting would want to make sure that your operatories are wide enough for wheelchairs, you're very accessible, your office doesn't have a lot of steps or stairs, and is easy to get in and to get out of. And once they get here, their health passport, which is extremely useful and vital, provides us with a very broad view of the patient's medical and or health condition. The thing that we can say, we don't have any drugs to put patients to sleep, nor do we put patients to sleep through any drug therapy. What we do is spend the time to make our patients feel comfortable. So a lot of times I have found by doing such that we are able to do a filling on a patient that absolutely refuses to see a needle or have an injection. We're able to actually coax the patient through the treatment as long as they're not having any discomfort.
I think one thing that makes our office unique in supporting the needs of those with intellectual disabilities, that everyone here is compassionate about treating patients that need, a little bit of extra care.
The IDDD waiver has dental as one of the covered services. And for those providers that wish to participate as waiver providers, they're able to get a special waiver ID number. And with that, they're able to bill at an enhanced reimbursement rate for providing services to people who are in the waiver. And that enhanced reimbursement is designed to acknowledge the increased complexity and the increased amount of time it can take to serve people who are in the waiver. So you don't have to be a waiver provider to serve somebody with IDDD needs, You don't even have to be a waiver provider to serve someone in the waiver, but in order to receive the enhanced reimbursement, you must be a waiver provider along with a Medicaid provider. We're in an enviable position with regard to the number of people that we cover through DC Medicaid and the quality of the benefits that we offer. And so any real conversation about the future has to look at how we turn those advantages into outcomes for the people that we serve.
The way we treat you is the way we treat everyone. The way we treat. So we try to best accommodate patients. I heard the saying once, treat people the way they don't know they want to be treated. I don't know where I heard it from, but it stuck in my mind. You know, in terms of giving customer service, we treat people the way they don't even know they want to be treated. You know, the handshake is not a mistake. The hello, how you doing is not a mistake. My staff is trained in comforting patients, basically by talking to patients. We have a very, very soothing atmosphere downstairs at New Horizons, and we really try our best to let patients know that it's going to be a comfortable, tranquil visit as possible. We don't use many psychotrops or a lot of medications to get our patients in treatment mode. We really do rely a lot on our attitude, the way we treat patients, and just talking. We found that most patients will be compliant if you comfort them and let them know that everything's going to be okay. So we use that mostly. There are instances where we would have to have a patient slightly medicated prior to treatment, but we won't do that until we've made several attempts to treat that patient non-medically. Our office has so many features that help patients. The innovative features are, most of our equipment is mobile, which can be moved at an instant, as you may have seen. The equipment is on rolling carts, and so whatever type of condition a patient's in, we can move to the side, to the front, to the foot of the patient, to the back of a patient, and so that's one of the features. The other innovative feature of our office is the open bay design. The open bay allows complete access for any type of patient. Came to me some years ago, just because I see a lot of patients in wheelchairs, on stretchers, and things such as that, and it was very difficult for us to see those patients in a regular dental setting. So I kind of, and it's going to sound really different, but I drive my car into a car wash sometime and I go, wow, you know, what if we could kind of drive patients into a dental suite without ever having to take them out of their comfort zone. And so I started drawing pictures and it's like, well, the open bay, and it made sense. So that's the biggest feature. The other features are waiting area for patients with long wheelchairs and stretchers. They can sit comfortably without being in interference with someone else or someone in the waiting room. So those features and the atmosphere. You know, we have a beach type atmosphere going, which is just so soothing. And the moment you walk into the office, it's like, wow, okay, you feel at ease. And so those features we want to, you know, just expose and let people know that they're there.
We have a wheelchair lift, you know, for certain wheelchairs that, you know, we can fit into the lift. And what this helps the provider do more efficient treatment, because, you know, they don't really have to go this way into the patient's mouth, you know, can just lift the wheelchair up.
Technology is just amazing. We have several technological pieces, which I'll show you by hand also. One being a Nomad X-ray, which is a handheld X-ray, and sort of like favors a target gun or a radar gun, and it's held by hand. It's very lightweight, and that once again allows us total access to a patient, no matter what type of condition the patient is. We also have an X-Pod. Everything is iPod, X-Pod, X-Pad. Well, an X-Pod is a handheld X-ray machine, and it captures the image that's exposed through the Nomad. So it's a small device, about a little larger than your cell phone, and that can be placed right next to a patient, and that also helps us to see any individual. Panorex X-ray machine. We are really big in digital. I mean, so the Panorex X-ray machine, of course, is utilized in a lot of offices, but again, ours is one that a patient, if they're in a wheelchair, can scoop right up underneath that X-ray machine, and it can be brought down to take a picture of the whole head. Those are our biggest innovative features that help us to see patients with disability, and it's just amazing how much easier it is for us to treat those patients that way. And we're proud to have those features in our office.
Most important thing, I think, is the door. It's not the standard size door, it accommodates a wheelchair and a gurney. Yes, the doors are big. Most people don't notice it, but it is bigger than all the operatory doors that we have upstairs. And it really just helps, whoever the transporter is, bring the patients in. When the patients walk in, if it is that they're not in a wheelchair or in a gurney, they have the option of sitting in one of our low chairs, which will be easy for them to get up. Or if they have in a wheelchair, they can come into this space over here. We can actually fit about 3 wheelchairs in this space.
Well, here's where the aides, here's where good dental staff, here's where family members, here's where CNAs become very helpful. A lot of times we find that if a patient is familiar with the person, they're less anxious in the dental setting. So we encourage facilities to send someone along that they know, a staff member. That helps to ease their tension. They don't feel fearful because they're not strangers, only strangers, and they have a level of trust. One of the things we also do is we don't always treat patients on their first visit. Okay, we get them familiar with the handpiece, the setting, their surroundings. We might clean their teeth. And that's another area that's very important, to just get them comfortable in the setting itself. Okay. A lot of times, I sometimes won't wear my white coat, because that's sometimes fearful. I'll wear a blue coat, something that's more soothing, so it doesn't look so intimidating. A lot of times, as children, someone's been traumatized through a dental visit, and it's usually by someone in a white coat. So those things, changing the coats and things, that's exactly. We found that over the years that these things are very helpful, and we can again never overemphasize the communication with that patient, talking to them, letting them know that it's okay, asking them what makes them more comfortable. How can I help you? Are you scared? Are you afraid? Can someone hold your hand? Will that make you more comfortable? So these things are just very, very important to do every time and repetitively.
As somebody who comes into this work from a very committed public health background, one thing I can say for sure is that good data and evidence will not speak for themselves to all audiences. I used to make that mistake myself, thinking it speaks for itself, and it doesn't necessarily. I think that good data and evidence are very important, and they're a critical foundation, but along with that, you need to be able to tell the story, and the story can look like the need in your community. It can look like cost effectiveness, keeping people out of emergency departments and emergency dental, and having them have their preventive work instead. You need to also have a good sense of your timing, your environment, and know where your champions, where your key kind of stakeholders are. The other important part of offering dental within the waiver specifically is that people with disabilities often have challenges with routine dental care and are in even greater need of having those services provided to them in a sensitive and targeted manner. As things improve, it's also getting people to understand the importance of oral health, because people do look at it as cosmetic. They think it's sort of, you just want a pretty smile. And it's like, no, people need to eat. It's the right thing to do.